Welcome to AHVC Heart Channel, a podcast that explores the wonders of the human heart. I'm your host, Joseph. Today in this episode, we have Dr. Chong here with us to share about CTO, and we are very excited to have you with us today. Welcome, Dr. Tan.
Thank you, Joseph. Hello, everyone. My name is Dr. Chong Hiok. I'm an interventional cardiologist with AHVC.
Okay, Dr. Tan, what are the causes of narrowing of the artery of the heart?
The most important cause is really cholesterol collecting inside the artery. Now, the cholesterol is not free-floating inside the artery, as it were, but rather it's collected underneath the skin of the artery. So there's no cholesterol hanging inside the artery, such as what you may get in a cave, the stalactite, the things hanging down, and the same thing coming up from the ground. So it's not free-floating, but it is collected within or underneath the skin of the artery. So this thing is a very slow process. Over time, more and more cholesterol will collect, and the artery will get more and more narrowed. And once the cholesterol is inside there, it will start collecting calcium. The calcium will make this narrowing very hard, very firm, which is kind of hardening of the artery. Now, when you do a CT scan, the calcium score is high. It just tells me that you have cholesterol and you have had it for quite some time. It does not reflect how narrowed the artery is.
In that case, what are the treatments available?
Well, the most important treatment, we will have to start the patient on medicine. And the most important medicine to prevent or slow down the accumulation of cholesterol will be cholesterol pill. Now, this cholesterol pill will lower your cholesterol in your blood. Most of the cholesterol is actually made from your liver. So even if you ate no cholesterol whatsoever, your liver will continue to make the cholesterol. So the cholesterol pill tells the liver to stop making the cholesterol. So when the cholesterol in the blood drops down, the accumulation of the cholesterol inside the artery will also slow down. Okay, so that's number one. The other treatment will be a bypass, which is open heart surgery. Now, this is a major surgery where you will be fully anesthetized and cut open and a bypass done. However, these days, most of these narrowings do not need an open heart surgery because we can use balloon and stent. So these are using small little tubes that enter your body through your wrist or from your femoral artery. Goes to your artery of the heart, and then we put a stent that holds the artery open.
I have a friend who had blocked artery. The doctor mentioned that he has chronic total occlusion of the artery. Cars can't be treated with a stent. Can you first explain what is chronic total occlusion?
Yes. Chronic total occlusion, which is a mouthful, we usually shorten to CTO. Now, chronic means something that has been there for a long time. Total occlusion explains itself, which means that the artery that has been completely blocked for a long time. So that's what I mean by chronic total occlusion or CTO. The thing is this, when the artery first narrows, it has to start from totally open artery and it gradually narrows and eventually blocked. Now, as long as there is a small path through the artery, it is quite easy to pass a wire through. And this is how the procedure of ballooning or stenting is done. We have to pass a very thin wire across the narrowing, and on that wire, we put a balloon down. The balloon will go to the area of narrowing and open it up, and therefore it creates a path for the stent to go through. Then we put in the stent, we expand the stent, we remove the balloon, and the stent holds the artery open. When the artery is completely blocked or totally occluded, we can see the upper part of the artery. We might be able to see the lower part of the artery, but in between the blocked segment, we can't see. So therefore, it makes crossing the wire very challenging. These days, we are able to use different wires to cross the occluded portion. But it is more technically challenged, which is why a lot of doctors may find it difficult to open the artery. Therefore, they may tell the patient, hey, you should go for a bypass or maybe just take medicine alone.
So is it true that a totally blocked artery can't be stented?
Now, as I said, it can be stented, but it takes more time and we have to use many different kind of equipment to do it. First of all, the normal wire that we use is very soft. It will not be able to penetrate this narrow artery. As I said earlier, with this narrowing that is inside the artery, with all the cholesterol that has been collecting for a long time, more calcium comes in. Therefore, a normal soft wire will not be able to go through. You can think of it as a road worker. In order to dig down the road, the worker has to use a jackhammer, which is a really powerful tool. So likewise, we have to use a wire that is very stiff. And that wire comes in different level of stiffness. Okay? Obviously, the more stiff it is, the more likely that the wire may puncture the artery. First of all, we use not just one wire. Sometimes we escalate to 2 wires. Okay, so there are different techniques of doing it. So at the end, it is still possible to open a CTO.
Can you discuss how this is done and what is the difference between doing a non-CTO and versus a CTO?
If you again imagine our highway, when one highway gets a lot of traffic, the traffic slows down. So when you come to that traffic jam, what do? You start thinking of going to the side road. For example, for the audience in Singapore, you're familiar with PIE. Okay, when PIE gets jammed, you may want to go by the other route, which means you take AYE, okay, you go through the tunnel, and then you join back in the PIE to reach the Changi Airport. So this is what happens in your body naturally. So when one artery is blocked, small little channel will open up, the side road will open up from the opposite artery. So if your left artery is chronically occluded, the right side artery will open up small channel to connect to the left side. So first of all, when we do a CTO, we may need more than one tube, more than one catheter. So you need 2 catheters, one catheter here, one catheter in the femoral artery. We inject both arteries together so that the contrast can go down the opposite artery, go up the side road or the side branch and join the artery that is blocked. In this way, we can see the contrast coming down the top of the artery. We can see the contrast coming from the opposite artery, and we know therefore how the road runs, okay, how the artery runs after the narrowing, so that we can join the part that is jammed on top to the part that is not jammed at the bottom. So that is one of the first and foremost important thing that we do. We need 2 tubes. We need extra contrast, inject contrast together on both sides. So now we can see the upper part artery, lower part artery. And now we have to use a stiff wire to try to join these things up. Okay? So as I said, sometimes one wire may not be enough. You may need 2 stiff wires. Sometimes we can't even do that because the rope won't join. And then we have to come to a retrograde technique. Retrograde, as it sounds, comes from the opposite direction. So instead of coming straight down, we take the opposite artery, we go up the side road, join the main artery, and then come back up the opposite way, which is what is meant by retrograde, from the opposite direction to do that. So all these takes a lot of time. So for a simple narrow artery, to do stenting may take as little as 15-20 minutes. A chronic total occlusion may take anywhere from 1 to 5 or even 6 hours.
So what can go wrong during the procedure?
So as I said, because the blocked segment is hard, so we need to use a stiff wire. Now obviously, when you poke through this completely occluded segment, you have no idea where you're going. So it is possible for the wire to come completely out of the artery. Fortunately, the segment is completely blocked, so you just can't make it any worse than it is. So we just pull back the wire and everything is back to what it was. That's one potential complication. The other complication is we have to put the wire within the inside, what we call the lumen of the artery. But the artery is not just whole, it's got a wall. So sometimes the artery can penetrate and then crawl within the wall space. Now, if you are not an experienced operator, you may not know that has happened. So you may use a balloon and blow it up. Okay, but by doing that, you will cause the wall of the artery to be squished or squashed down. into the lumen of the artery. And by putting a stent there, you basically obliterated the whole inside of the artery. So that is another potential complication. And of course, it's a long procedure, so we need to use a lot of contrast. Contrast itself can potentially cause damage to the kidney, so we have to watch the amount of contrast we use. And the whole procedure is done under X-ray, so there could potentially be a lot of radiation, and that can cause a little bit of skin inflammation, a little bit of redness. In some very obese patients, because the dosage of the X-ray is high, it can cause a skin breakdown. But those are very rare. Okay, so the common complication actually is failure to open the artery because the blockage has been there for too long, it's too hard, and it's too long.
Is the success rate 100%?
No, unfortunately not. Okay, there are different reasons why the CTO cannot be successfully opened. For example, it's been there for a long time. There's a lot of calcium. We cannot penetrate with the wire. We cannot penetrate with the balloon. Or it's so long that the wire cannot stay within the artery, or maybe there is no side road for us to go up. The side road may be too tortuous for us to go up. So all these are different factors which contributes to our failing to opening up the artery. But overall, in experienced hands, the success rate can be anywhere from 85 to 90%. Even globally, in the best center, the best hands, success rate is maybe around 95, maybe 97%. Okay, so there is nobody who can guarantee a 100% success rate.
What can be done if it does not succeed?
The option would either be pure medical therapy. Now, if it's in a large artery, such as the left anterior descending artery, which is the main artery that comes out the front, and the narrowing is near the top, you can consider bypass surgery. If it's one of the right-sided artery and it cannot be opened, you might say, okay, having looked through the whole procedure, there may be a chance if I try it again, I can succeed. In which case, you tell the patient, hey, look, are you all right to go through this procedure a second time? The second time procedure can give you a total success rate of approaching 90%. Okay, again, there's no guarantee. So either bypass, a second try, or the final option is, of course, you leave it alone and you put patient on medicine. Now, you hope with the medicine, more side road will open, so maybe you can come back 6 months, 1 year later, and you make a second attempt.
That brings us to the end of today's episode of AHVC Heart Channel. I hope you found our conversation with Dr. Tan as enlightening and informative as I did. Heart health is a topic that cannot be emphasized enough, and we are very grateful to have the opportunity to explore in such depth. If you enjoyed today's episode, please don't forget to share it with your loved ones. Stay tuned for the next episode. Thank you, Dr. Tan.
Thank you. Don't forget, press like, subscribe, and comment below.